Yes. Okay, we've started recording. I was just going through some my personal experience with doing the exam. I was telling them that I took the exam twice, and my second time, the second time I approached it was quite different from the first, and I realized that in Hong Kong, with the papers, the way they ask a question and the way they phrase a question seems to be quite different from what I'm used to when I was in the UK and New Zealand. So they often don't quite often they don't come for don't go for a straightforward answer. They usually every bit of information they give you, it usually has a deeper meaning to it. So do definitely read the question very carefully. And with regards to how I prepared for the exam personally, I'm not a very book person, and I never really went to read loads and loads of textbooks and made loads of notes. So I bought a lot of different online question banks in well, mostly in the UK because I train in the UK, and gave myself a lot of practice. I was really getting into an exam mentality and getting very match fit for the multiple choice questions that they like doing here. So that was, for me, that was sufficient. Although I did use some of the textbooks which Timothy would outline in his part to help me study. And actually on this part, I'd like to hand over to Timothy.
Thanks, Andy. Well, I think for textbooks, again, the same way as for Andy, I don't think there's a dedicated reading list. Although we have sort of alluded to the reading list for this exam. I felt a lot of people study for this exam and pass exam. Only one person has really used a textbook, so to say, and studied from the textbook and passed. And that was the Oxford Handbook of Medicine, and the two of them, the Oxford Handbook of Medicine and the Oxford Handbook of Specialties. I wouldn't recommend this technique because reading textbooks to study for exams is a little bit of a low yield, because when we talk about techniques and studying techniques, everyone has a different style of studying. Some people do better with reading. Some people do better with watching videos. Some people do better with listening to podcasts. But at the end of the day, this is an MCQ exam, and the only way to get better at doing MCQs is by doing a lot of MCQs. So for reading lists, if you're thinking, okay, I'm going to take this exam in maybe a year's time or 1.5 years time, and I want to have a long lead time to study and actually know the medicine and know the questions well, then I would recommend you, okay, fine, if you really want to study, then you should be aiming at the questions are slightly more difficult than a regular MBBS exam. Although it is aimed to be the Hong Kong, is the exam questions, standard of the exam questions are based on the Hong Kong University of Medicine and the Chinese CUHK, Chinese University of Hong Kong final MBBS exam questions. But the CUHK and the HKU exam questions are of a slightly higher caliber than what you would expect from, for example, maybe a UK or an Australian final MBBS exam. There are quite a few schools now which don't even have a final MBBS exam. So doing a full, all the specialties together as a study may be a new challenge. If you want to read books, I strongly recommend actually reading up to the MRCS level and MRCP, so which is the membership of the Royal College of Physicians or membership of the Royal College of Surgeons. That's the sort of level which they may expect from graduates, because this exam is not just testing medical students, they are testing doctors who have had practice. And then generally I find when the examiners were examining people and doing the clinical exams, even at the vivas. I know this is a question about the written exams. This preparation is about the written exams, but I think preparing for the clinicals and the writtens together, sort of like forming a knowledge base, is quite useful, because like once you finish your written exam, you only have 2 months to prepare for the clinical exam. And trying to like squeeze everything into that very tight time frame is actually not the best idea. Although I do know a few people who have done that, Marcus being one. But yes, if you have time to dedicate yourself to studying, then studying like MRCP, MRCS, MRCOG textbooks, and that's what I did. I studied up to the membership level, and I was very confident when I did my written exam, and I did quite okay in the written exam. So I think if you want to be confident, if you want to be sure of passing, that would be one way to do it. For the reading list, medicine and surgery take up the bulk of the exam. So I would suggest that you spend most of your time preparing these 2 major topics. But I would also highly recommend that you don't miss out the other minor topics, because in this exam, although there's no more negative marking, when there was negative marking, it was more important to get the correct questions, and there was like slightly more high stakes. Now without negative marking, the stakes are not that high, but this exam, it's not just a simple pass-fail. You get 50% questions correct, you're through. I believe the passing mark is actually a bit higher than 50%. Like previously, it was we would say that if you pass like the 50, if you got 50% of the questions correct, but you would definitely get some wrong, and because of negative marking, you would fail the exam. Now I think without that, oh, I think it is the 50%. Hey, please correct me if I'm wrong, guys.
The ratio is 60% now without the negative marking.
Right. So yeah. So without the negative marking, is 60%. I think before the negative marking was 50%, but you would need to get like more questions correct. So if the ratio is 60% without negative marking, it's the standard is a bit higher. So my mentality is that every question counts. You're talking about razor-thin margins here when you're trying to pass this exam. If you get 1 or 2 questions may decide the entire exam. So you should aim to cover as much material as possible. Don't think that, 10 questions in basic science, I'm not going to study any basic science. I think that's like quite useless. So you don't spend any time on basic science. I think you still need to know a little bit of basic science, because like, if you get 3 or 4 questions from there correct, that could push you over the passing mark instead. It's also it's also more time efficient to study the smaller topics, for example, like psychiatry, family medicine, ONG. These are relatively smaller topics which take less time to study and less time to do the questions, but they can score you a lot of marks if you can, answer them confidently. So that would be my approach. To prepare for those topics, for example, like pediatrics, obstetrics, again, what we did was a lot of us used like the online question banks, as Andy mentioned, the most commonly used ones. And nothing is sponsored here. We're not being sponsored. We're not being paid by the different banks to push them to you. I used past tests, and I used to write questions for past tests, so I will show for past tests. But I believe past medicine was a very, very valuable resource for a lot of people, past medicine. So I've also used some of the past medicine question banks. So I think those are quite useful. And this on exam as well, the new BMJ on exam, they have a lot of new question banks as well. I think that's quite useful. And they have a lot of mobile apps. So a lot of these questions can be done on the go. You should be trying to, there'll be quite a few of you, just to carry on since I'm already talking. The other thing about preparing for this exam is that a lot of us are studying and working at the same time. Most of us are doctors full-time. And when we prepare for the exam, there'll be some people who do full-time study. And if you can afford to do that, that would be fantastic. That's great, because that way you can dedicate yourself to the exam and just studying for it. But if you're working and studying at the same time, it's doable as well, but it'll take a lot more effort. if you by using an online question bank and by using an online app with an iPad, with a phone, you can do them on the go. You can do them within your free times, like between walk rounds, between clinics. When you're on public transport, when you're having dinner with your fiance or with your girlfriend, you can just be doing questions like nonstop. So that can be useful as well. And a lot of these apps also give you instant feedback. A lot of them have like gamify options, so like sort of scoring your marks. And then when you redo your question banks, you can try to improve on your previous mark, and you can like repeat the questions. So just by doing a question once and thinking that you know the answer, you may not actually know the answer. Why don't instead of like going on and on about like preparing, I could talk about exam prep all day long. Let's let Harriet and Oscar continue the conversation, and when we can come back, I'll share some more tips if you guys want.
Harriet, are you ready for us? Yeah.
Yeah, I'm ready. I've made some notes. So something that people often, can you hear me okay? Yeah?
Yeah.
Okay.
No problem.
So something that people often ask is, how far through your career are you? Because I think for some people like Marcus, who was a consultant when he came here, it had been a long time since you'd had to do any basic sciences or go outside of your specialty. For me, I was relatively early on in my career. I graduated in 2012 in the UK at UCL in London. I did 2 years of F1 and F2. I did a year of obs and gynae, and I did a year of HIV and genitourinary medicine. And during that time, I sat part 1 of MRCP. And I think having done a lot of questions for MRCP helped me, because I knew that for the medicine section, I was pretty happy that I had a solid base, and it meant I could concentrate more time on the other things like surgery. I'd also done my DRCOG, which is the diploma of obs and gynae based at a GP level. And it's like an MCQ exam that's all obs and gynae. And I was really happy with my obs and gynae side of things as well. So I pasted a link into the chat if people want to have a look at the website there. You can see where it says format of part 1 examination. You've got paper 1 and paper 2. And when I sat it in 2016, I sat the second sitting of 2016 without adequate preparation, really. I finished it in the UK, the job that I was doing in the summer of 2016, and came over here and sat the exam in September, not really expecting to pass, but with to see what the exam was like. And I found it really difficult because at that point it had negative marking. So I probably answered too many questions. I think it's really good that they've got rid of the negative marking, because it means you can now put an answer even if you're not sure and not have to worry about losing marks. And then I passed on the first sitting of 2017, because when I sat that exam in 2016, as I was leaving the second exam, I met somebody else who was in a similar situation to me, who was also sitting the exam, and we formed a band of brothers, if you will, and we got together regularly and went through questions. We went through our thought process on the questions, what was right, what was wrong. And what I would say is, if you do get access to any questions, sometimes finding the answer is not as straightforward as you think it will be. Sometimes the only way to work out what the right question is to work out that other parts of it are wrong. And then you will find on the 5th or 6th page of Up to Date, this really hidden sentence that tells you the answer to the question. So one of the big things that I would recommend to people is that they sign up for an Up to Date subscription. I know that some universities have them. I know that sometimes you can get it through work, but even if you can't get it for free somewhere else, I would say that it is definitely a very worthwhile investment for sitting this exam. What else? Question banks, I agree. Doing question banks is important to get your head in the game. And what I would do is I would do the question banks, and then if there was a question on a topic that I realized I didn't know anything about, I would then go away to my textbooks and I would read around that subject, write a few little notes, and then a lot of the question banks give you the option to repeat questions that you have failed previously, and I would redo the question and see if the knowledge had sunk in. I agree with the statement that the exam is somewhere between MBBS finals in the UK and specialty exams, and I would therefore aim at early specialty level questions. So I would go for MRCP Part 1 question banks. I would go for GP exam question banks. I would go for Part 1 MRCS question banks. For the basic science, I think it's very hard to hit those 10 marks, but with things like finals question banks and surgical question banks, you will get questions about pharmacology, which is what they put into the basic science, anatomy, which is what they put into basic science, and also things like statistics. So I would make sure you're really hot on your sensitivity, your specificity, your false positive, your all of those. I would really make sure you can do those questions. I know certainly in my medical school, they were questions that came up, and I did find that those questions also came up on this exam. I personally used Past Medicine and Past Test. I think they were both good. From memory, Past Medicine is quite a bit cheaper than Past Test, but they're very similar in terms of level and how easy they are to use. I agree with the app and iPad and phone angle. A lot of them can be used offline. When you're working and trying to study for an exam, it's really hard to get in there, and you think that you have to sit down for 1 or 2 hours every day to get the learning in, but I would suggest that little and often is really the way to go. If you're in a lift and you've got time for 3 questions, do those 3 questions in the lift. If you're having a lunch break and you've got time for 2 questions, do 2 questions. If you're on hold to someone on the phone, trying to get through to a microbiologist, for example, do a couple of questions. You just have to fit it in. Your commute, before you go to bed, when you wake up in the morning, just questions, because doing it that way, you can get quite a lot of questions in. What else? Oh, going on to exam technique, I'm sure we've all sat a lot of exams, and personally, I found that I did have time to finish this exam. I know that there are certain exams where you're really rushing to get to the end. I think I worked it out at the time. You get just under a minute per question, and that was about right. So the way that they do it is they give you a paper booklet with it written in English and it also written in Chinese. And my understanding is it's the same question in English and in Chinese, but they say if you're not sure, defer to the English version of the question. And I don't read Chinese, so I just did it all in English. I went through, I marked my answer onto the paper itself. If I wasn't sure, I started knowing that better to go on to one that I might know the answer to straight away rather than spending a lot of time on a question that I didn't know. I went through, I did the whole exam in the booklet, and then I went through, I checked that I had read it correctly. I checked if I was still happy with my answer, and then I transferred it over to the paper, knowing that if I came up to the last few minutes and there wasn't anything that was transferred over, I had something to transfer over, even if I hadn't double checked it. And that for me works. Other people may choose to mark as they go and then check afterwards. But for me, that's what I did, and it worked. Yeah, I think that's my take. The other thing I would say is this can be psychologically a difficult time, especially if you have quit a job in one country and moved to another country in order to sit the exam. It can really feel like the system is against you and that nobody wants you to pass. I would say that all the people in this community do want you to pass, and if you're struggling, please reach out. We'd be very happy to hear from you. And if you have other people that are trying to sit the exam at the same time, they can be a real support to you, not just when you're sitting the exam, but when you do the clinical exam, and then when you do the internship. The people that I studied for the written exam for were the people that I called and had lunch with when I was an intern. They're the people that I talked to because they were experiencing similar things to me, and they're still people that I meet up with now and like have dinner or lunch with. So find the people who can support you and support them back.
Well, thank you very much, Harriet. Oscar, are you ready to do some sharing?
Yeah, I mean, I think Harriet and Andy and Timothy have probably covered most things. I won't repeat all of them, but I'll just re-emphasize a few points. I graduated in the UK back in 2013. I spent a few years working. And what I did was I paired up my MRCP preparation along with my HKLME preparation. And I see Timothy just nodding his head there. And I think a lot of us do that. So if any of you are in the UK or Australia or whatever, where you have got membership exams, try and pair it up with that. So if you've got an MRCP Part 1 coming up, sort of pair it up so that, in fact, if you're preparing for the MRCP Part 1, I would say you pretty much won't have to cover most of the questions in medicine for HKMLE, apart from perhaps some very sort of local disease like TBs and things like that. So those are the sort of extra things that you have to be careful when doing the HKMLE. But on top of that, I'll just say that, you know, you guys are probably a lot luckier now than we were back a few years ago, where, you know, they had negative marking. That's completely out of the window now. So I'd say go on and try every single question. But use all the resources that are available to you right now. You know, we've got our society where we've got the WhatsApp group where, you know, if you have a question that you're not sure, just put it on there and ask what do people think. And, you know, your fellow candidates will try and discuss it with you. If your guys struggle, one of us will always answer it. Either Timothy will chip in, Harriet will chip in. I sometimes chip in on some cardiology and medicine related questions.
So I would say a caveat to that is try and work it out for yourself, because it's important to know why you think that's the answer, not just what the right answer is, because otherwise you won't remember it.
Yeah, I agree with what Harriet said there. I think obviously some of the questions are not so straightforward. Like Harriet had mentioned earlier on, sometimes you might think 2 or 3 of the choices are also correct, but you know, I think that's for us to then discuss and decide which one is the best answer. Remember, this is what we call a best answer type of questions. Just covered briefly about, you know, what your sort of revision style would be. I know some of you are still in work, some of you are now out of work. I think, you know, if you're at work, Harriet has already mentioned a few tips for you, but I think, you know, try and do as many questions as you can. I personally isn't exactly a textbook person, so I don't like reading books. So I just end up doing question banks after question banks after question banks. If you're out of work, then make sure that you give yourself an environment where you can revise properly. Because when you're out of work, you're not really in sync with the clinical environment. You start to lose touch. So either form your little study groups. We've got plenty of them in our WhatsApp group. So make sure you use the resources that are available to you.
Okay, so I can do a little bit of sharing as well. I passed the exam I passed both parts of the exam on the first try. I had graduated from medical school 15 years prior, and my specialty is ophthalmology. So I was from a field that's not really a core topic for the exam. And I tell you this, I share with you as a message of hope that if I can do it, you guys can definitely do it. Especially the closer you are to having graduated from medical school. I think that is a real key advantage for you. So just remember that. Some things about the exam. Number one, you're never ready. You'll never feel ready enough for this exam. I remember that month leading up to it, which is when I did most of the studying, was only 1 month prior. And I would tell my wife, oh, there's so much, I don't know, forget it. I don't think I could sit it this time. And she says, no, just do it, give it a try. That way, you know what's on it. And I was lucky enough to pass on for the first time. But I think that is not just because my wife was telling me that, but I think it's really excellent advice for anybody, that you'll just know that up front you won't ever feel ready enough. And so I think you really need to just set a date and stick to it no matter what gets in the way. In terms of the question banks, I think that those can be very helpful. I personally like them. I used all three of the main ones. Those would be the past medicine, the on exam, and past tests. All three of those have already been mentioned, particularly from Timothy and Harriet. I think also Oscar mentioned it. So all three of those, so I demoed all three. And I do have a pick among those. I'm also not sponsored, as Timothy said, by any of the companies. So from a really neutral standpoint, I would say that the past medicine one was the best value, because the explanations are longer, more detailed, and I tended to read the whole explanation to really try to learn from every question. Past test has been around probably the longest, but I didn't find their explanations as good. I would say my number 2 in that list would be on exam, and then my third pick would be past test. But you know what? If you have a favorite that you've had since like you were in first year medical school or whatever, then just stick with whatever resource you really feel most comfortable. I think that having something that's gonna make you feel secure in your studies, I think is really valuable as well. Harriet mentioned about the up-to-date. I never actually used up-to-date, but I can tell you this. I studied, well, I was with the faculty of Hong Kong U for 6 years. And I remember that the medical students at Hong Kong U would definitely use the up-to-date resource. So I suspect that's not coincidence. In other words, what Harriet was saying about helping you find answers to local resource materials, I think that though using the up-to-date sounds like a very sound approach to that. So I would highly recommend that you explore that. There is one resource that I haven't heard mentioned so far, and that's the CUHK terminology. CUHK terminology is a local resource. It's an excellent one put together by CUHK University. And basically it's on the topic of obstetrics and gynecology. And I would highly recommend that you memorize that PDF file, print it out, highlight it, really make it your best friend, because that is the one resource that I can think of that will buy you time for the clinical exam. So when you study it, it'll help you answer the questions for the written exam, but it will also be one less thing that you have to study if you know it super well for the clinical exam. Keep in mind that the clinical exam is at least as challenging, if not more challenging, than the written. As daunting as that sounds, take it step by step, take my word for it, and make that a resource that you have just digested fully and memorized. Not a casual flip through the PDF every now and then on your phone or your computer. No, I mean really print it out, go old school, and just absorb that material like there was no tomorrow. And that's going to help you for both the written as well as the clinical. Now, on the topic of full-time versus full-time study versus keep working your day job, I would recommend, and this is what I did, is to keep my day job, right? So I was working at Hong Kong U, maybe you're overseas somewhere in Europe or wherever you are. We've got a really kind of a global following. And I think that's something special about the Licentiate Society. So wherever you are, consider, if you can, certainly there's an economic implication because you can keep earning your monthly salary. And apart from that, you're still actively involved, and that's probably the most important part. You're actively involved with patient care. So for the written exam, it may not be as helpful, but for the clinical ones, there is strategic value in having daily contact with patients, people that you're accountable for, that you need to explain things to and do informed consents for, because all of those people skills and clinical skills are going to become very invaluable for you when you have to sit the clinical exam. It's just an extension of the things that you do every day. So instead, if you hide away in a library or the back of a coffee shop, and you could get lost and really lose that people part. And that's really important for the clinical one. So I recommend that if you can, continue to do your clinical job and at least give the exam one good try while you're still working, which is what I did. And I this advice that I would recommend for everybody. If you feel you afterwards it didn't work out for you and you need to resit all or part of the exam, then I fully understand that maybe you should, try to just do a full-time study for the exam itself. But at least try this method because I think there's some certain value to that. In terms of its exam day strategy, and we're going to get to your questions very soon. Definitely, like Harriet said, it's not a rush for time. Just do the exam. Actually, even try to slow it down. And there's this concept of mindfulness and really slowing down and being in from the moment. I recommend if there was ever an exam that you just slow down, and as odd as this sounds, try to enjoy your exam day and really just soak it up. Read every question extra carefully and take your time with it. You will have enough time, and because you really need to soak out every question possible that you can get right out of it. So I remember, because for me, it was like 15 years prior, that I would remember, like for ONG, I was in a certain rotation in third year medical school. And I would think, oh yeah, there was that one detail about this one test and blah, blah, blah. And then I would sit there and I think about it. Yeah, you know what? I think it's answer whatever. And I would mark that answer based on my kind of like just remembering way back to certain times in medical school or the exams that you studied for back then. And I did it. I did all 240 questions. I didn't skip any material. And this was before they had this so-called negative marking. I want to correct something that was said earlier. Mathematically, there's no raising of standard. It's the same exact standard, whether you answer all of them right and you get 50% right, or you have no negative marking and you need a 60% threshold. Mathematically, they're identical. What it does, though, is it takes that mental energy, that stress off you of worrying people that, oh, should I answer this question or not? Now it's actually you're going to have it simpler than I did and that we all did in the room here. And that's just answer every question without having to think about whether you should be answering or not. So that's some of my tips. I'm eager to get to your questions and we can tackle those. If there's no other one, any other comments from our panelists?
Yeah, so when Marcus said it's important to do this exam while you're at hospital, I think something I can add to that would be I did the same. I think it's really useful to be in hospital when you're doing the exam because immediately, again, after doing the written exam, you only have like 2 months to go to the clinical exam. And having access to the hospital, having access to patients, having access to clinics to like see patients in the off time, to actually prepare for this exam, I think that's a deal that can't be taken away because that can be very difficult. So if you can stay in hospital, then you should by all means stay in your job while you're doing this exam.